All right. Our lymphatic system and immune system are intricately intertwined with one another. They kind of go hand in hand. Whenever in my job, thinking about the lymphatic system, the important role that it plays is, if you think about someone, let's say, sprains their ankle, right? The lymphatic system helps to remove the swelling, helps to remove the waste products from the cells and the rest of the body, and it will help drain them into your venous system to be filtered in your kidneys and liver, and then have those waste products taken out of the venous blood and excreted through your bowel movements, either through urinary system or through your intestinal system. Piper?
Is that what this means on the side of your neck?
Yes. So you have many lymph nodes, about like 500 to 600 in your body. Sharvie?
Sometimes at night, my mom likes to do her lymphatic drainage.
Very cool. So overall, the lymphatic system, it's a collection of cells and organs that, the immune system, excuse me, is a collection of cells and organs that destroys or neutralizes pathogens that would otherwise cause disease or death. Lymphatic system, series of vessels, cells, organs that carry fluids to the bloodstream and filters pathogens from the blood. So once fluid enters into a lymph node or into the lymph system, it transforms from anatomically speaking, it transforms from waste products to lymph. It's the interstitial fluid once it has entered that lymphatic system. We can also have accumulations of fluid that is referred to as lymphedema, and it can have some serious medical consequences. A lymph node is one of those small thingies, they're bean-shaped, located throughout your lymphatic system. So we can see here in this image, this illustrates the point of the AIDS epidemic. The AIDS epidemic was particularly devastating because in the early 1980s, medical professionals in Los Angeles found a cluster of persons who had a unknown disease that quickly killed them. It was a rare pneumonia caused by a fungus. This fungus was an opportunistic pathogen that caused disease in individuals with suppressed or underdeveloped immune systems, the very young. And so they had 5 patients in LA, the ages of 29 to 36, and they should have been in the prime of kind of their immunity. Then a couple days later, a cluster of 8 cases was reported in New York City, also involving young patients, this time exhibiting a rare form of skin cancer. And so then, as it turned out, these young patients were compromised, and they had very low numbers of white blood cells. They had effectively lost a major part of their immune system. which was then coined the term acquired immune deficiency syndrome, or AIDS. In the early years of the AIDS and HIV epidemic, the disease was 100% fatal. However, in recent years, it has become much more manageable, and people are able to live long, healthy lives. And we even have prevention medication for people who are at high risk for acquiring AIDS and HIV. So some structure to the lymphatic system. The lymphatic vessels begin as a blind ending or closed at one end capillaries that then feed into larger and larger lymphatic vessels. And then they eventually empty into the bloodstream by a series of ducts. We have about 500 to 600 lymph nodes throughout our body. Lymph is not actively pumped, unlike in the arterial system in our body. It's similar to our venous system, which is passively pumped. And it's pumped through by movements of the body. So let's take that ankle sprain example again. In patients who have ankle sprain, in the first couple of days, I will use the lymphatic system and pressure and movement to my advantage to help patients, to help reduce the amount of swelling in an area and disability. And so I will take like a really strong elastic wrap to wrap it around their foot and ankle, increase that pressure to then use that in addition to movement and help force all of that swelling out and through the lymphatic system. Lymph flows from the lymphatic capillaries through the lymphatic vessels and then is dumped into the circulatory system via those lymphatic ducts located at the junction of the jugular and subclavian veins in the neck. And so we can see somewhat in this image this lymphatic system and some key structures within it. All right. Any questions on this kind of broad anatomy of the lymphatic system? All right. So then let's talk about these lymphatic capillaries. They're also called terminal lymphatics. These are vessels where interstitial fluid enters the lymphatic system to become lymph fluid. These are located kind of everywhere in the body, with a couple of exceptions. Central nervous system, bone marrow, bones, teeth, and the cornea of the eye. Everywhere else you're going to have lymph nodes and lymphatic capillaries to be able to carry this fluid away, these waste products away from where they're located. They're about 1 cell layer thick, so you can see kind of on that right side, that interstitial fluid, and then we have our lymph within the cell, and it's only 1 cell thick, that cell wall, so relatively very thin. When the interstitial pressure is low, the endothelial flaps, so you can see kind of at the bottom of that right-hand image, those flaps right there. When that pressure is low, those flaps close shut so that we prevent the backflow of blood. So you can think of the design of them, kind of like the semi-lunar valves in the heart. You have similar valves in the venous system as well. And then as that interstitial pressure increases, the filaments pull on the endothelial cell flaps, and they open up further to allow that fluid to come in. In the small intestine, we have dietary triglycerides combining with other lipids and proteins, and they form a milky fluid called chyle. The chyle travels through the lymphatic system and eventually enters into the bloodstream to help with fats and vitamins distribution. All right. Any questions on these lymphatic capillaries? Okay. All right. These major trunks of the lymphatic system. We have, so these smaller capillaries dump into larger vessels, which then dump into larger vessels. The lymphatic vessels are similar to veins. They have those valves. The one-way valves are located close to one another, and they cause a bulge in the lymphatic vessel, which ends up giving the vessels kind of like this beaded appearance. Superficial and deep lymphatics eventually merge to form larger lymphatic vessels known as lymphatic trunks. Lymphatic trunks. And so we can see in this image kind of two regions where our lymphatic system drains into subclavian veins. We have we have our thoracic duct that begins just beneath the diaphragm and receives lymph from the lower abdomen, pelvis, and lower limbs. And then, and we also have these other lymphatic systems. And so in this image, what we're really trying to illustrate is our right and left thoracic ducts are asymmetrical. So you can see the left side, most of the body is served, most of the fluid from your body will be dumped through that left thoracic duct into your left subclavian vein, whereas the right thoracic duct will just kind of take over the right side of the head, neck, torso, down to about the diaphragm and umbilicus, and that upper arm, whereas the left takes care of the rest of the body. Any questions on where the lymph system is served by? All right. So this slide should be familiar. Within immune function, we have a couple of different layers. We have barrier defenses, so this is things like skin, mucous membranes. Then we have rapid but non-specific immune response, which consists of some specialized cells and soluble factors. Then we have the slower, more specific and effective adaptive immune response that involves a bunch of cell types, soluble factors, and it's controlled by the white blood cells that help control our immune responses. All right. So a couple of cell types that we're going to focus on this right-hand side of the image. So stemming from that lymphoid stem cell and that lymphoblast, we have B cells. The B cells, or B lymphocytes, are immune cells that function primarily by producing antibodies, and antibodies bind specifically to pathogens, pathogen-associated molecules known as antigens. Antigens are chemical structure on the surface of a pathogen that binds to T or B lymphocyte antigen receptors. We also have T cells that don't secrete antibodies, but they perform a bunch of different functions of that adaptive immune system, or adaptive immune response, excuse me. We also have plasma cells. It's a B cell that's differentiated to respond to antigen binding and has gained an ability to secrete soluble antibodies. And then we have natural killer cells. Natural killer cells circulate in the blood that contain cell-killing granules in its cytoplasm. And so kind of when we have that response from that T cells and those B cells, we get, if we want to essentially encapsulate or kill a cell, these natural killer cells will kind of engulf those pathogens or a virally infected cell and kill it off to protect you. All right. So B lymphocytes, they're going to be generating those diverse antibodies. T lymphocytes are going to secrete those chemical messengers. Plasma cells are going to secrete the antibodies, and the natural killer cells are going to destroy those infected cells. All right. Any questions on these cells? These cells also originate from bone marrow, and so it is a primary lymphoid organ, bone marrow, and also the thalamus gland. This is where lymphocytes mature, proliferate, and are selected, which enables them to attack pathogens without harming the rest of the cells of the body. All right. So let's talk about the thymus. Thymus is a bobbled organ found in the space between the sternum and the aorta of the heart. It's the connective tissue divides the thymus into lobules via extensions called trabeculae. In the outer region of the thymus, it's known as the cortex, contains large amounts of thymocytes with some epithelial cells, macrophages, and dendritic cells. We also have the cortex on the cortex that's densely packed, so it stains more intensely than the rest of the thymus that we can see here. And then we also have the medulla, where thymocytes migrate before leaving the thymus. They contain a less dense collection of thymocytes, epithelial cells, and dendritic cells. And so the role of these, we also have secondary lymphoid organs. Lymphocytes develop and mature in these primary organs, but then they mount immune responses from the secondary organs. A naive lymphocyte is one that has left the primary organ and entered into a secondary organ. This includes germal centers, which are sites of rapidly dividing and differentiating B lymphocytes, specialized postcapillary vessels known as high endothelial venules. These venules are thicker, more columnar than normal endothelial cells, and allow the blood to directly enter the tissues. So let's talk about a lymph node here. Lymph nodes function to remove debris and pathogens from the lymph, sometimes referred to as the filters of the lymph. Any bacteria that infect the interstitial fluid are taken up by the lymphatic capillaries and transported to kind of a regional lymph node. So you can think of these as kind of like a collection or a depot or a warehouse where all of that lymph is flowing to. We have both afferent and efferent lymphatic vessels. So afferent coming towards the lymph node, efferent going away. Yeah. So that's the big picture on the lymph nodes. The spleen, it's a major secondary lymphoid organ. It's attached to the lateral border of the stomach via a special ligament. It's fragile. It's dark red due to its extensive vascularization. It's also sometimes called the filterer of the blood because of that vascularization and the presence of macrophages and dendritic cells that remove microbes and other materials from the blood, including dying red blood cells. No. We also have lymphoid nodules. They have a simpler architecture compared to the spleen and lymph nodes, that they consist of a dense cluster of lymphocytes without surrounding fibrous capsule. Tonsils are some of these lymphoid nodules located along the inner surface of the pharynx and are important to developing immunity to oral pathogens. Our tonsils are located at the back of the throat. We also have a pharyngeal tonsil, also referred to as the adenoid when it's swollen. And so we can see our palatine tonsils right there, just lateral to the uvula and inferior to that soft palate. We can also see that pharyngeal tonsil at the top image right there. Quite often tonsils are removed in children. They can often be kind of our first sign of infection or sickness. And, often get removed because they get swollen due to infection. Sometimes they can also harbor pathogens, which can be potentially dangerous to the end user, the human who has them. And so, oftentimes you will see these removed in children. I remember when I got my tonsils removed, I got all three removed. I got my tonsils and my adenoid removed. And often, yes, Piper. Go for it.
I was just gonna ask, does having good
So does having the tonsils removed have any effect on their immune system long term? So I don't know specifics, but the mere fact that we are removing them, specifically in children, tells me one of two things. One is that because we have other secondary lymphoid centers, like the spleen, it's not hypercritical that we have them. Also the fact that it can sometimes be kind of the jumping off point for infection can potentially be problematic. You know, you're not going to remove the tonsils in a person who doesn't regularly get infected with something and where their tonsils are swelling. You know, so the impetus for my mother to ask for my tonsils to be removed was that I got sick, you know, once a month for like 6 months straight. And so my mom finally said, okay, we're done here with this. We're getting your tonsils removed. Very Midwestern mom. And so, you know, will you potentially lose some immune function? Possibly. Does it affect people a lot long term? Probably not, because it's such a regular procedure. Any other questions about tonsils? DePaul?
Wait, sorry, I was in the bathroom for that. How much does it affect like the immune function?
Probably not a lot because it's done so regularly. Because we have other secondary lymphatic centers. All right. Last thing I got for you all today, it's called a mucosa-associated lymphoid tissue module, or short MALT. Is an aggregate of lymphoid follicles associated with mucous membrane epithelial cells. MALT makes up a domed-shaped structure found underlying the mucosa of our GI tract, breast tissue, lungs, and eyes. We have patches that contain specialized endothelial cells that sample material from our intestinal lumen and transport it to these kind of nearby follicles so that the adaptive immune response to potential pathogens can be mounted or triggered. A similar process occurs involving these MALT cells in the mucosa and submucosa of the appendix, and a blockage of the lumen can trigger these cells to elicit an inflammatory response that can lead to appendicitis. One of my anatomy professor in undergrad relayed a story to us where he was in a almost car accident, slammed on the brakes really hard. He was in the passenger side, and he had the lap belt over him. And then when they slammed on the brakes, he slammed on the brakes, and then he had some direct trauma to the area where the appendix is, and then a couple days later, he had, or a day or two later, he had some acute abdominal tenderness and pain, and so he had to have his appendix removed. So that triggering of the inflammatory response. Appendix similar to...
Sorry, this is Nick in the upper school. Are the nurses on the radio?
Yes, we are.
Where was I? So like that inflammatory response appendix, much like our tonsils, our appendix, we don't have the world's best understanding of its utility currently. We have theories around that it has something to do with immunity because we have these malt cells in our appendix. But it's another one of those structures where if it is not removed, it can cause serious pain, irritation, and complications in patients. Whereas if we remove it, there does not seem to be dramatic long-term effects or adverse effects to patients who get it removed. But we're not seeking out people who haven't had their appendix removed to go and try and remove it. It's just kind of when, similar to tonsils, kind of when we get that inflammatory response or there's that injury there, we say go ahead and remove it, and there isn't a lot of long-term risks to doing so. Finally, we have bronchus-associated lymphoid tissue, or BALT. They are lymphoid follicular structures that overlie an epithelial layer along the bifurcations of the bronchi and between the bronchi and the arteries. They have a typically less organized structure of other lymphoid nodules, as well as the tonsils. They're effective against inhaled pathogens. So these are going to be triggering if we inhale a pathogen. Those are going to trigger. All right, malts and BALTs. All right. That is the totality of what I've prepared for today. Anyone have any questions on everything before I stop the recording? All right.